discussing news and issues in orthopedics and spine healthcare. This is SpineTalk.
Hi, this is Dr. John Shim, and today I'm here with Jason Mazza, orthopedic assistant. And off camera, we have Dr. David Malloy, neurosurgeon from Clearwater, Florida, talking about a very relevant topic to a lot of our student athletes. And that's the topic about sports-related concussions. Jason's going to discuss a study brought out by one of the British journals about the consensus statement on sports-related concussions. And take it away.
So the paper that we're looking at this week is a consensus statement on concussion in sport. This was presented back in Berlin in October of 2016. The paper itself, published in the British Journal of Sports Medicine here recently in 2018, the paper is based on the meeting, which the goal of the meeting was to further develop a conceptual understanding of sports-related concussion. The original framework for this was developed back in 2001 in Vienna. The panel that developed this is made up of a wide range of healthcare professionals, organizations, and other experts in the field. They reviewed over 60,000 articles in coming up with the framework here. Now, the panel at this 2016 meeting modified the existing definition of what a sports-related concussion is, along with updating recommendations within each section, which are known as the 11 Rs. Those 11 Rs are recognize, remove, reevaluation, rest, rehabilitation, refer, recovery, return to sport, reconsider, resident effects, and risk reduction. And the conclusions drawn from this are basically the science of sports-related concussion continues to evolve, and that individual management decisions remain in the hands of the clinical provider's judgment. So, from looking at this, Dr. Shim, and from some of the research out there, there's somewhere 3.5 to 4 million athletes a year that report concussions. There's probably another 50% that go unreported. We know that long-term, we are finding that concussions can lead to cognitive impairment and many other mental health problems. What is your main takeaway from the guidelines that are created here? And also, is this something useful that you would use in clinical practice?
Well, so my interpretation is this is more of a consensus that they looked at a lot of information and synthesized the information together. But in the end, it still comes down to clinical judgment. There's standard things that we should do when we have concerns. There was some interesting information in the report. Women have a higher rates of developing concussions than men. We know lots of women participate in sports, and I think this is just true. They may not have the health-related professionals on site that some of the more popular sports like football would have. But so we need to be cognizant of concussions in women. But in general, I think it's common sense stuff. If the athlete comes off the field, you saw a potential mechanism of an injury, they're dazed, they're confused, they lost memory, they are unconscious, they wobble, obviously you're going to take them off the field. The question is, how do you look out for that, and then how do you assess those things for long-term management? I think every clinician does it slightly differently, and they say these are guidelines. Clinicians do it differently. I'd like to bring Dr. David Malloy into this conversation as a neurosurgeon practicing, dealing with these athletes. How did you manage these things?
The most important thing, I think, is the recognition that the injuries actually occurred. I think one of the significant factors in sports-related concussion is that many of them are underreported. And that may be due to external pressures from teammates, from coaches, sometimes from parents, who merely want the athlete to return to the sport. But once the injury is recognized, and I think the onus is on us to make sure that the patient is allowed the time to recover and protected from situations where they could aggravate the injury that already exists. Typically, I would be in a position where I would not evaluate the patient sometimes until 2 or 3 days after the injury occurred. In my previous practice, the most common injury would be related to high school football. High school football is a Friday night sport, and usually the patients weren't seen in my clinic at the earliest until Monday morning. My practice was obviously after performing an appropriate exam and whatever other ancillary tests that might be indicated. Not all of these patients required imaging, but if I suspected a concussion had occurred and the patient was still symptomatic with headache, lightheadedness, dizziness, any sign of any neurological alteration, I advised them to avoid exercise or physical activity. Essentially asked them to rest as much as they could. Obviously allowed them to return to school if possible so they could carry on with their academics, but they were to avoid any sort of physical activity, being in the weight room, running, or anything like that, until I could reevaluate them either later that week or early the following week. If the patients at reevaluation remained symptomatic, then the restrictions remained in place. If the patients were asymptomatic at the time of reevaluation, my advice was to then begin to perform some physical activity, but in a non-contact form. So I would allow them to go to the weight room, I'd allow them to run, perform some aerobic exercise. If they became symptomatic or had recurrent symptoms during that activity, then they were essentially brought back to square one and reevaluated at a later date. If they were asymptomatic with aerobic activity, then I would allow them to return to practice. If they were asymptomatic in practice, then I would allow a return to contact in practice, and then fully release them back to their sport if they remained asymptomatic through that. That typically worked fairly well, but again, one of the big problems was trying to figure out whether the patients were actually being truthful with you when they came back for reevaluation.
Well, so that brings up one of the suggestions that, as clinicians on site during these games is that we do what's called a sports concussion assessment. And there's a 5th edition of it called the Sports Concussion Assessment Tool. And basically, you take the athlete off the field and you need to bring them into a location where you can have 15 to 20 minutes to actually assess them. You're asking them memory tests, you're asking them to count backwards, you're asking them about their whereabouts, and you're actually doing a mini neurologic examination as well as trying to figure out their cognitive function. I think theoretically it makes perfect sense, but I'll tell you, I'm not sure this is really what's being practiced by the community physicians and community professionals out there at the stadiums for most of the sports. I think, sure, level 1, Division 1 football, probably yes. Professional athletes, definitely. But we're talking about children, and we're talking about high schoolers. That's one of my concerns. As you said, it may be underreported. I'm concerned it may not be even under considered, actually, because these assessment tools, are not being done. I guess we need to caution on being more careful than less careful, but you and I both know, especially with football and some of these really intensive sports, there is a lot of pressures not to report these injuries. It is a real concern. I don't want to get into this philosophical discussion of the so-called wussification of sports. But if it's my child, my son, I would definitely want to know that he does or does not have a concussion. And if he does, I don't want him playing.
I think we have to, when you bring it down to the community level, it is different. I agree at the higher end collegiate sports, certainly at the professional level, you can see it being done. You see the blue tent at the NFL games and the dark room at the NHL games where they take players who have suspected concussions. As physicians, if we're going to involve ourselves in managing this sort of injury, I think we have to really go back to our basic principle, is that we're there to look after the patient. And at a community level, particularly when you're in a smaller community, some of these smaller rural communities where, honestly, high school football is the biggest thing in town, there's a lot of pressure sometimes on the physician on the sideline to maybe minimize or under emphasize the nature of the concussive injury. And I can see the pressures that are there. I mean, if you're in a small community and everybody in the stands is your potential patient population, sometimes the pressure is there not to do something that might offend them. But I think you've got to go back to that. You're not there to treat the football team. You're not there to treat the fans. You're not there to treat the coach. The most important person that's there is the injured student athlete, and we just need to make that our priority.
So I do think that's why it's important for us to get this information out there. We need to provide cover for our colleagues, because you're right, we got to go back to the fundamentals, do no harm. And we also need the community to understand that. I mean, Dr. Malloy, can you describe to us what are the ramifications of somebody who's concussed, don't take the adequate time to recover, and then potentially get concussed again? What happens to these people?
Well, I mean, I think what we're all trying to avoid is the second impact syndrome, which, although rare, has potentially catastrophic results, and obviously the most catastrophic one is patients can die from second impact syndrome. You can get essentially malignant brain edema related to significant second impact in a patient who has not yet recovered from the first one. The other thing I think over time is the effects of repeated concussive injury on the developing brain. Clearly, there can be cognitive impairment over the long term. There can be behavioral issues over the long term. And I think we have to really start to look very hard at, is the risk worth it? Allowing these patients to return to the sport when you know that they have the potential for these problems down the road. We've talked a bit about just returning to sport after the single concussion. Another problem that we frequently encounter is seeing patients who are on their second or third concussion, maybe that season, or their second or third concussion during their high school career. What do we advise them to do, with regards to dropping the sport, maybe moving on to something else? Most of these kids are not going to make their living at their sport. These kids are going to have to move on and use their brains for something else other than playing football for the rest of their lives. And that's a difficult message to get across to them sometimes too.
And I think the problem for that is the science still isn't there, because we can't really do scientific research in this field. We do what's called clinical research, which is we follow up on reported things and try to make some guidelines based on what's reported. The truth is, if we had to use a scientific method, we would take 100 people, and this sounds awful, but we would actually create concussions on them, and then take 50 of them and allow them to do certain activities, and take 50 of them and allow them to do other activities, and then compare to see if there's any long-term benefits or bad effects of our actions. We just don't have that kind of information, so we have to do our best based on the information we have. And again, as a father, all of us have relatives. We want what's best for our folks. The challenge, of course, is sometimes the community has a different concept of what's best. So we still have individual responsibilities to individual people, and I think we have to keep that at foremost. What I don't want to do, however, though, and we're always concerned about it, is be overly alarmist about it too. So unfortunately, though, we don't have the data, but I do think we err on the side of caution. Jason, do you have any comments on the study? Any other questions you'd like to present to Dr. Malloy?
No, I think this was a good discussion about this. Certainly we could go off topic and go many different directions with this, but I think that from the framework that was presented here, this kind of really open the door for more questions out there.
Dr. Malloy, any other comments from out there off the studio?
No, at this time, I don't.
Well, this is Dr. John Shim. Today we're talking about a very interesting topic, very relevant topic of sports-related concussions. I hope this enlightened you on some of the issues we're faced with, and I hope this will help you understand when that doctor tells somebody you need to come off the field and we need to evaluate you because this is what's good for you. Thank you for listening. Take care.